Hi, my name is Christine Salazar. I've been a patient with Dr. Thomas for, I'd say about 7 years. I started going to him prior to that, my surgery, to injections for my knees. After 5 years, they didn't work. So it was just a matter of time before I would need surgery.
Christine and I met in 2011. I was kind of reminding myself today of it. And the first time I met her, she had bone-on-bone arthritis of her knee. And so what we did was, we did the gel injections for a while. And when the arthritis is basically when the cartilages worn away, there's just no cushion there. So we did the gel shots for a while. Those seemed to help, but as you found over the years, it was just less and less relief each time. And so we talked about it together because we want to basically formulate our own plan. And so the knee replacement was the best thing, because going in and cleaning it out wouldn't have really helped you at all. So what we want to do is take the arthritis out and replace that with metal and plastic, and that's what we do with the knee replacement. The cushioning is gone, so in order to make artificial cushioning, we basically make an incision in the front of the knee and then cut off probably less than a centimeter of bone off all the shin bone and the thigh bone. And by doing that, we replace that with metal and plastic, and that's what your new surfaces are basically. So instead of that horrible pain when the bone is pushing on the bone, it's basically metal on plastic. And your own ligaments, you have those for the stability of your knee, but the things that cause the pain, the bone and the bone spurs, are completely gone.
The surgery went perfect, never had any infections. I was on track with everything he said, followed all my appointments, therapy I was having at home, and I am the best I've ever been in almost 10 years.
So my job as a surgeon in the operating room is we want to go in and get everything lined up correctly, because God gave you kind of a way that your knees are lined up, and we want to replicate that as much as possible. And so if the knee's off in a slant or something like that, it's going to wear it out faster, and you're going to have pain, and it won't be successful. So we have little measuring devices to measure and make sure that we kind of restore the anatomy, not the way that it is, but the way that it's supposed to be. And so that's step one that we want to do. We want to be careful to prevent any infection or to prevent you from having complications. And so that's my part of it and then just watch you while you're in the hospital. And then better than a half of it is what you do afterwards, because as we've seen, so many people have knee surgery by other doctors and they don't do their rehab, but the rehab by the patient is so important, to move your knee, to get up and to walk, to make the muscles active, and to basically just get used to your new knees. That's what really leads to success. It makes the swelling go down and gets your movement back and gives you confidence in your knee.
I can walk now without any pain. I can even do anywhere from, depending what kind of day and how I'm feeling, anywhere from 4,000 to 12,000 steps a day. When before that, I was only on my feet 20 minutes because my knees were so much in pain. He's been the best for me. I mean, I get a little teary-eyed. I was really bad, and he helped me through the whole process, and I got better, and I'll be just thankful for him, because I could almost literally say I was up crawling on my hands and knees so bad. And but now I even forget I even had knee pain. I mean, I'm on the go. I could go anywhere from 4 or 5 hours a day, when before, like I said, it was just 30 minutes. And he's been the excellent doctor from day one. He followed my care and very carefully, always asked me if I had any problem. Having a good doctor is the best that any patient can have for a good recovery. That's the number one for me, having a good doctor and explaining everything to you. And if you didn't understand it, you could ask him again. And he's a family member now for me. I'm just totally recovered without any pain at all. Anything at all. And I just love him to death. And I recommend him a lot to a lot of my friends and family and just strangers because of the recovery I had.